Sound check. Check one, check two.
Oh, hang on. Why can't that? Oh, there it is. It's there.
Hi, Dr. Dan.
Hello,
How are
Dr.
you?
Wendy. How are you? Thank you for
I'm
joining
good.
me for today's show. And let's start off with an apology that it's been that long since we last had you on the show.
A few things in the world have changed, have they not?
Just
in that time.
Yeah, and look, I guess I could hide behind COVID and use that as an excuse, but I don't think there is an excuse for not having you back on the show for such a long period of time, and I do hope that we don't leave it so long for next time. But anyway, that's tomorrow's problem. Let's deal with today. So good to have you again, and I am very familiar with your work, and we've talked before, as we've said on the show. But I wonder if we could just take a quick moment to kind of bring people up to speed with who you are, because you are. Can I use the word prolific? I want to say.
You can use whatever word you'd like.
I tell you why I'm using the word prolific. It's because you are possibly, to me, first and foremost known as a co-author on The Vocal Athlete with Marcy Rosenberg. And Marcy, of course, has been on the show before. And this, people, if you're watching the show, if you don't own this, why not? And secondly, do yourself a favor, go and grab a copy, because this is the number one text that all avocational and professional singers should have on their bookshelf. But I've been reading this book also. In fact, I started this book a couple of days ago. And who should I be about to read but a chapter from Dr. Wendy LeBorgne? It's like, I can't get away from this woman. You're everywhere.
You might want to run for your life. No, I have chapters in a lot of books, and yes, there you might see my name pop up beyond my textbook in both speech pathology textbooks in the area of voice and voice disorders, as well as this world of performing arts and vocal athletes, which has really been my specialty niche within the broader field of voice pathology. But that's been my passion, and where I've really married the art and the science of voice, quite frankly, for the last 25, almost 26 years at this point.
That's I guess the role of a singing voice specialist, isn't it? To bring, and you're a clinical singing voice specialist, someone who has qualifications, a foot in both worlds, if you will, the science and the art, and bringing together that speech pathology background to the singing voice. How my daughter, yesterday I was taking her to an event, and she's 15, and she just, teenagers will ask the most random of questions at the most random of times. There was no reason for this question at all. It came from left field, but she said, "So, Dad, how did you get into being a singing teacher?" Random. And so I said, well, actually, it's kind of a convoluted kind of pathway to get to being where I am. I'm going to ask you the same question, random teenage question. How did you get to being a speech pathologist with a passion for singing?
It actually was the opposite. So I actually came from a performing background. So I've actually been performing professionally since I was really little, since probably 5, 6 years old. And then I have a BFA in musical theater. That was my passion, my goal, be on Broadway. And I am just not in the way I originally intended as a performer. So I have my BFA from Shenandoah Conservatory. During my senior year of college, I fell in love with the science behind the care of the voice. And at the time, actually, it's been longer than that now. It was in the early 90s when there weren't people doing this, but I came from a place where my dad was a physical therapist and my sister was an athlete. So, and my mom ran the practice. And so I wanted to be a physical therapist for professional singers. Um, and it didn't really exist in the way it does right now. So I said, I'm going to create my own path. And I had these amazing mentors that encouraged me, that allowed me, that, really facilitated this blending the art and science. So I have both my master's and my doctorate in communication sciences and disorders, which is in the United States, the degree in speech pathology.
Yeah.
And I have my research area specifically is in belting, and what gets hired, how do we sustain it, what are the acoustic features, and that sort of has springboarded my career forward. But I've spent the majority of my career in both worlds. So looking at people's vocal cords on a daily basis, assessing the functionality of what they're doing, not just are you healthy or are you not?
Yeah.
But I like to think of it as, are you efficient? Can you meet market demands?
Yeah.
So thinking of it much more as a physical therapist would look at the physiology and function of the system versus just, is this something we treat medically or surgically, which really falls into that role of otolaryngologist or ENT.
Yeah.
And getting people back on stage, and then, really how your voice is the single most important aspect of being able to communicate.
The single most. And I think it's not until someone no longer has the facility of their voice do we suddenly realize, and this is not just singers, of course, this is human beings. It's one of the things that separates us from other species is the ability to communicate and clearly articulate our thought, and the moment you don't have voice to do that, you are quite disabled, aren't you?
Yeah, and I think that I very much live in that crisis management world, right? We don't, most people, and just like our physical health, oftentimes we don't always do preventative wellness, although I think you're probably better doing it in Australia than sometimes we are in America. We want crisis management. So it is that ability to, oh my gosh, this isn't working. I can't do this. I need to go see a doctor right now. So people would often seek my services or my attention, not always on the preventative wellness side, but on the crisis management. My voice isn't working for me. I can't perform. I've lost my range. The communication went very badly, whatever it might be. And that's when they seek my help versus sometimes, hey, as a vocal athlete, we can train you beforehand so you're less likely to injure yourself. But that's, a lot of what I do is crisis management.
And I think that's where we probably can sort of leap off to our subject today, because there's so many things that can be done preventatively before we hit crisis point. And that's not to say that, prevention is an absolute guarantee against crisis, because it isn't. There are things that happen, that are outside of a performer's control, a singer's control. But I want to talk to you today about vocal reconditioning. And it's going to be, I'm sure we'll talk about COVID in the process of discussing this, because so many of us as singers found ourselves not able to use our voice, whether it was due to infection or just reduced the ability to be actually singing. I wonder whether maybe we need to talk firstly about what does a conditioned voice look like? And then maybe if we can leap into talking about, well, if that's what a conditioned voice looks like, what do we do to recondition a voice?
I think that's a great place to start. And so when we think about conditioning, as an athlete, and I think it's much easier for many of us to think of this in terms of physical athletes, we have to be conditioned to meet the demands of the sport and the intensity that we're playing. So, for example, and we'll transition this into singing in just a second, but if you only need to do a mile of walking, that's a different conditioning level than being able to do a marathon.
Yeah.
And so as a vocal athlete, it's going to depend on what your load is. So are you singing in your church choir once a week, or are you on Broadway 8 times a week, or performing 8 times a week? Or are you maintaining a rigorous concert tour where you are in a new city every day doing some crazy amount of performances? So each of those require a different vocal fitness level, if you will. And so the conditioning based off of vocal dose, how much, and vocal load, how loud and how long, that's going to be a little bit different for everyone. So when we think about both conditioning and deconditioning, we have to take those factors into consideration, and that each of us start at a different place.
Yeah.
And so that becomes really important to remember, that we're not all starting, even if the end goal is the same, we might not all be starting at the same vocal fitness level to begin with.
Yeah.
And just like physical fitness, we decondition very quickly from a muscular standpoint, truly within days, and certainly within weeks, both from a respiratory alignment and postural standpoint. If you don't go to the gym, you actually start to lose the strength training, and then vocally as well.
Yeah, that muscle tone starts to. Do we know how long that is? Is there a parameter of time that people can work to?
So we do with some of the skeletal muscles, and again, it's going to depend on starting fitness level and your age as well, because biology plays a role in this in terms of, as we age, we decondition faster, and it takes us longer to get in shape.
Yeah,
it's easier to actually stay in shape than it is to get in shape.
Yeah.
There have been some, for sure, respiratory detraining. There's been some work on the EMST, which is the expiratory muscle strength trainer, by Dr. Susan Baker-Brem, who her dissertation was actually on how long does it take you to detrain after you stop doing respiratory training from a voice perspective. We know that happens within a couple of weeks.
Yeah, right. It's interesting, isn't it, that it actually, let me ask a follow-up question. If we know how long it takes, that detraining is happening within a couple of weeks, how long do we, maybe this is getting ahead of myself, how long does it take to recondition the voice?
That depends.
Yeah, okay.
Again, on age. Like if you're younger, and if you're in your 20s, if we take age groups, 20s, 30s, 40s, 50s, 60s, 70s, 80s, we know if we all do the same exercise, your body responds more quickly to exercise in your younger years than it does the older you get. You will still improve. You will still reach goals, and potentially not quite the same goals, but you will still reach those goals. It just takes longer. So one of my work colleagues for a long time, Dr. Steve Gorman, his dissertation, his research was on the impact of doing vocal function exercises or some muscular strength training in the aging male voice. So again, we have to take each of these populations individually. We can't just make big, broad assumptions across a population when they haven't all been studied. But what we know is that oftentimes some of the original work that was done on vocal function exercises, it might take them about that 4 to 6 to 8 week mark to get to their goal. In that aging population, we were looking closer. He was looking closer at them getting to that 12 weeks
3
to
months.
Get to their vocal goal. Yeah.
It's interesting, isn't it? Because in some respects, n equals 1, doesn't it? And so if you're a person in your 60s who has been consistently, using their voice perhaps at a professional standard, that and maybe goes through a bout of sickness and therefore needs to go through the process of reconditioning, would we expect that person to differ from the person who is an avocational singer, sings a couple of times a month at their local church, goes through a similar sickness and is needing to recondition? Is that likely that those two individuals are going to recover differently?
Yeah, I think we all recover differently.
Yeah,
like 100%, and we all starting at a different place.
Yeah.
As well. And biology and physiology and recovery and injury repair within our own bodies, I think goes well beyond the voice box. You have to think outside of that voice box.
Yeah.
There's a lot of factors that factor into it. And I think one of the hardest things, if we go back to maybe even these last 2 years, where folks have been using their voices most oftentimes in a different way than they were prior to, for me, it was March 13th of 2020 when the world shut down a little bit. But prior to that, the way that we interacted face to face, the way that we sang, the way that we were in rehearsals, those are all very different than potentially the last 2 to 3 years.
Yeah.
For many folks.
Yes.
And so even just how we talk to a computer screen is different than how we talk to folks face to face. So we lose a little bit of that strength in the muscle on a lot of levels. And never mind the singing aspect of things. Singing on Zoom, singing in your own space and never being in a bigger space. Like, there are so many things, never mind the masking and everything else that we've all gone through. So it has changed the game. And I'm not sure we know all of the answers to these questions. Yeah. But what we do know is it certainly has changed. And it is, people think that they can go back to exactly or close to exactly what they were doing and just kind of go back into their normal vocal fitness routine. And sometimes it's not working for them. Yeah,
it's certainly been something I've observed in my students who there's definitely seems to have been not a 100% shift, but a lot more auditions are being conducted to camera now. Not all, but it feels like there are certainly more, and this is a new skill for a lot of singers who are wanting to go down that road of audition, and learning to just back off a little, because we really want to punch through that glass lens, don't we? And there is sort of an exertion that comes, and it may not even be that we're aware of it. And I wonder if that's something that we experience in that process of speaking to camera, singing to camera, trying to impress upon the lens the emotive state that we're trying to communicate. Is that what you're observing?
Absolutely. Mostly here in the United States, many things are still on self-tapes. Right. So, and that is a whole different skill set than walking into a room and doing an audition. The anxiety that self-taping ensues upon many of my performers is quite substantial in a very different way than walking into a live audition room. I think most of us do not like to watch ourselves or listen to ourselves like in playback. Right. And so when you walk into an audition room and you do a live audition, it's there. You're not generally seeing yourself in a mirror. You're certainly not playing it back for yourself because it's your 2 minutes with the production team and then you leave. And now it is create the self-tape, watch the self-tape. Oh my gosh, I'm looking at my one eyebrow going up and the other one's not. I need to redo that tape. Oh my goodness, I think I heard a little vocal glitch there. Oh, my dog was barking. I got to redo that again. All of these things.
Yeah.
And so we're actually seeing people vocally fatiguing with self tapes because they're doing them like 15 times to try to get a, I'm going to put in quotation marks, a perfect version.
Take. Yeah.
I don't think perfection exists. I think we do our best in our moment.
Yeah.
And I also I have watched anxiety levels, I perceive at least, increase a little bit with just, you've got to do hair and makeup and all of this and lighting and in
audio.
A completely different way than we've ever done before.
Yeah. 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 It's certainly been, I mean, this was around pre-COVID, but it's almost like it's entered the normal zeitgeist of the process, and it's almost expected that you can do this now.
Right. And then now, I mean, I don't know how it is in Australia or other parts of the world where your viewers are watching, but it's oftentimes right now when you're getting to sort of those final cuts that you're actually getting in the room with the audition team or the production team. And that then is like, again, this shift, because it's like, oh my gosh, I haven't been in the room for 2 years and here I am. And this feels different than self-taping. Okay, I remember this, right? And so it's very interesting to watch all of this unfold.
Yeah.
How is it where you are?
What's that? Sorry?
How is it where you are? Like, are people mostly in the room? Is it 50-50 self-tape?
I would venture for the 2 or 3 students that I work with who are in this process, I would say it's kind of sitting at about 70-30, like 70% tape, and exactly the things you're highlighting, that vocal load that comes with having done it 15 times before you actually, and I don't think the 15th take will have been any better than 7 or 2 or 1. It's just that you've got no more to give, and you settle for what you've done in that particular moment. And also your voice has got to a point where actually it's got no more to give. Again, because it can be that we are driving the voice just that little bit too hard in that process of recording. So that's certainly one thing that's happened as a result of COVID. I think we've seen a real uptick in that. But the other thing that happened too was we were doing less singing during COVID. I'm sorry for everyone to remind you that COVID is a thing. We're talking a little bit of COVID today. But as a result, we had this downturn in vocalization. Certainly vocalization in so much as vocal dosing, as you put it, and the regular use of the voice. And I have noted over the last couple of years, as people are starting to re-emerge post-pandemic, that there is this need to re-establish what they had pre-pandemic, BC, before COVID. I wonder if you could step us through some of the key things that we want to go looking for when we are looking to, and this is not simply for COVID, that we are wanting to step ourselves through for reconditioning the voice.
Yeah, and whatever reason reconditioning, maybe you had a baby and you took a few months off to like be a mom or whatever.
That could be an excellent reason.
And you stepped away from your real role. So I think anytime we are stepping away from our normal, typical voice use for probably more than a week or 2, you're going to have some level of deconditioning. What we've seen is just a lot of shift potentially over the last several years where we went from just a big shift even as we're coming back. So when you come back, again, think of it in terms of exercise. So when you exercise, you want to incrementally step up either how much you're doing or how much weight you're lifting, a little bit at a time. So, for example, over the course of 4 weeks, if we were going to take that, if you haven't been singing at all for 3 months, let's just say. So then what you want to think about doing is you want to maybe think about singing 5 or 10 minutes 3 times during your day, as opposed to singing 30 minutes in one chunk of time. Because what happens is if you are singing beyond the threshold of what you can do with at least, in my opinion, 80% accuracy in terms of efficiency of voice production, you are starting to ingrain suboptimal habits and start to compensate. So we want to stop just before that threshold. So let's say week 1 was 5 to 10 minutes 3 times a day. I also firmly believe you should probably only intensely train 5 days a week. Similar to other physical exercise, you don't train 7 days a week. You take 2 days of rest, or at least if I were doing weightlifting or training for a marathon, I'm going to take 2 days where I might do yoga or Pilates or something that is not quite as intense as my running strength training program. So you have to think about that in terms of voice too. Each week, oftentimes with my performers, we want to see if we can increase the dose or load by about 5 minutes per practice session. So if week 1 was 5 to 10 minutes 3 times, week 2 might be 10 to 15 minutes 3 times. Once you start getting up to about 20 minutes per practice session, I mean, realistically, I like my singers to be smart about their practicing, where we are singing probably no more than an hour and a half, maybe 2 hours intensely per day. I think we can do a lot of other things that don't just involve singing to train our voices. I think on that note as well, one of the important things when we go back to training, 5 minutes of singing high and loud is going to impact your voice differently than 5 minutes of singing comfortable mid-range at a moderate intensity. And so when we talk about this, we also have to take into consideration, it's not just length of time you're doing it, it's the tessitura that you're singing in, it is the dynamic level that you're singing at. All of those things play into this reconditioning.
Yeah, I'm smiling from ear to ear because so much of what you were saying I'm so pleased to report will be so familiar to
Good.
my audience, because it's where I'm regularly, really impressing upon people that incremental development of the voice and the importance of vocal rest, which I love that you put in there, this need to have those couple of days off where we're not placing the voice under that sort of reconditioning load.
Yep.
Yeah. And so we're doing that for up to 4 weeks if we're younger, and maybe it takes a little bit longer if we're that bit older, yeah?
Absolutely. And I think it depends on what kind of condition do you need to get into to meet the demands that you have for your voice, both speaking and singing. Because so often it's not just the singing voice that needs reconditioning. It is sometimes the speaking voice, which can be the detrimental part for many people. So I think it has to be that combination of both. And that's what we do in recovery from vocal fold surgery too. It's not great, you have surgery and you go back to doing exactly what you were doing before in terms of talk time and sing time. It's this reconditioning both of singing and speaking voice as during the recovery process.
Do we think that there's perhaps an opportunity in the reconditioning of a voice to really focus in on certain technical attributes to, if you will, lay a fresh foundation of technical orientation of the voice? Do we know whether the unconditioned voice is more impressionable than the conditioned voice? Has there been any research into that sphere?
Ooh, I don't know, but that sounds like a wonderful research idea. I don't know that how you measure, again, some of the deconditioning things are difficult to measure. What do you measure? Are you measuring the artistry? Are you measuring muscle strength? Are you measuring tone? So I don't know that that exists. I'm not saying that it doesn't.
No.
So somebody can hop in if they know that this literature is out there.
Yeah.
I think, you know, theoretically, maybe
there might be a PhD in there for someone to look into.
But I mean, I also think if we all think back, if we pull a song that we sang 15 years ago, let's say you and I are both well out of college at this point, but if we sang a song that we sang in college, many of the old habits that we had then will reemerge in whatever just picking up that song and redoing it, right?
Yep.
Even though both of our techniques, I assume, have changed from our collegiate days, right? So that doesn't mean we've deconditioned and reconditioned or anything like that. I think that goes back to motor memory.
Yeah.
So I think the deconditioning would depend on that individual as well. But again, somebody could be doing that for a dissertation. That sounds like a lovely idea.
A lovely idea for someone else. I also, I wonder what, this is an opportunity maybe for you to educate us around inflammatory response of vocal folds, you know, that protective mechanism that can come for a voice that is under significant load. What do we see any change in that in the reconditioning process? Like, is it, and I'm guessing, but correct me if I'm wrong, that is a part of why we are incrementally reinstituting that condition?
So I don't know that there's any firm scientific evidence to say, hey, if we do this, then this is how our vocal folds are going to respond. Because I don't know that we have all of that information from a deconditioned to a reconditioned standpoint.
Right.
Some of the things we do know, right, there is both muscular fatigue. So when you get tired from using the muscles, they fatigue, whether it's respiratory, whether it's laryngeal, whether it's articulatory, or a combination of the three. And then we have something called mucosal fatigue, where when we get impact of those vocal folds over and over, we get inflammation of the mucosa simply from impact stress. And so when we think about reconditioning, is it muscular fatigue? Is it mucosal fatigue? Is it a combination of both? Because the treatment or the reconditioning might look different depending on which it is. So things that aid in rebuilding muscular fatigue are those short, frequent practice sessions, just like, you know, going to the gym. If my end goal is to lift 100 pounds, I might start at 15, and then the next week I'm increasing to 17, and the next week to 20, right? So that's increasing strength training over time. We're not getting any impact though, right?
Yeah.
So from an impact stress standpoint, the things that impact mucosal fatigue are often hydration, some of the things you were talking about, like the vocal folds, specifically in women and men both. We have something called fibronectin, which is helpful in some of the healing and wound healing, because every time we bang our vocal cords together, we're getting these little micro traumas. But, you know, there are things, collagen, elastin, fibronectin in the cellular structure of the vocal folds that need time to repair themselves.
Yeah.
And so, again, it's going to depend on that individual. I think it depends a little bit on their age. Just like a 20-year-old gymnast can do crazy backflips and recover much quickly than a 40-year-old gymnast. Some of that's simply about the repair.
Yeah.
And so, again, I don't know that there's firm scientific evidence for over 4 weeks this should happen from a laryngeal standpoint. in more broad terms, we understand a little bit about skeletal muscle, which can't always be applied directly to vocal muscle, but to some degree. And then we understand this impact of mucosal fatigue. I don't know that we always get mucosal reconditioning, but I do think that getting back in the habit of making sure you're hydrated well, that you are aware of some of the factors like hormones, things like that may impact our ability to repair themselves.
As I'm listening to you, I'm thinking about just how important it is to be, if you are going into the reconditioning phase, to have had that opportunity pre-reconditioning, to have spent time with your own voice, to really know that n equals 1. What are my normal parameters as an individual, and to be able to measure these sort of general goals and apply them, individually. And I can only think that that's a really important thing to be aware of.
Yeah, I mean, it's habit building too, right?
Yeah.
So even if you're not having the opportunity to sing as much as you want to be singing, there are some habits that you can be building related to rest, fueling yourself adequately to meet the demands of an artist. Hydration obviously is important, but it's going to take 2 hours after you've had something to drink for it to systemically impact your vocal folds. So nothing we're eating or drinking immediately impacts our vocal folds. Not smoking, vaping, marijuana use, those types of things, even acid reflux creates a suboptimal environment oftentimes for our vocal folds. So all of these little habits that we can start practicing in combination with muscle reconditioning are so vitally important, because those factors will, in my opinion and in my clinical experience, if you're not following through with some of the vocal health and hygiene habits, it will generally take you longer to see the results you might want to see.
Yeah.
Not everybody, but oftentimes we can facilitate a better, faster recovery if we combine vocal diet, vocal exercise together versus just doing one and then the other.
I wonder, and I've just looked at the time, and we probably need to walk towards the exit point of today's discussion. But I wonder whether we can just briefly, maybe finish off by, let's say there's an individual and they've been doing all the things that we've been discussing. They've been incremental in their approach. They've been hydrating well, not just systemically, but they've also been using something like a vocal nebulizer, so that superficial surface hydration. Their diet's good. They're doing all the right things, but things are just not quite coming together. At what point do they need to look for additional care? What would you be recommending?
If they're doing all of those things and they've been doing them for at least, I would say 3 weeks, 4 weeks maybe, then they probably need to seek some outside help.
Yeah.
Just simply to go, why aren't you recovering in the way that we would expect you to recover? So in general, if you have hoarseness or a voice disorder that lasts more than about 7 to 10 days, in the absence of illness or injury, our recommendation is that you really do get it checked out visually and functionally. So that would be my recommendation. You wouldn't want to wait too long.
No. And that's, that is good advice that I highly recommend to everyone that they take up, because you don't want to leave it go too long. And it's important, because I think there can be a fear around, well, what might I find? but to leave it unattended can be have a significantly worse outcome. So I think there are so many things that can be done for a voice that has fallen into disrepair, whether it be, you know, pathology or just purely a functional, so organic or functional. And yeah, I join with Dr. Wendy in encouraging people to make sure you get your voice checked out from a qualified laryngologist. It's a good thing to do. Wendy, we probably need to wrap it up. And as it was the last time we were together, we've not been short of things that we could continue talking about, but I do want to give you the final word. Is there anything that you've been thinking as we've been talking about this that you want to mention that maybe people need to be aware of?
You know, nothing like that jumps out at me. Just if you love singing, I think one of the biggest things that I have seen in the last few years is people have to some degree lost some of their joy in singing.
Right.
And I really would encourage you, if singing is something that you have always loved, go sing a song you love, just for the sake of doing it. Fall back in love with your voice.
Fall back in love with your voice. I don't think there could be a better way to end the show. So we're going to end it there. Thank you so much for coming on today. Can I make a commitment that it won't be another 4 years before I invite you back?
I'm fine with that. I'm here. I'm here on the other side of the world, but I'm here.
You weren't just here. You were here early because I gave you, we got the time zone thing. Oh, yes. I'm always getting the time zone thing wrong. Anyway, thank you so much for coming on today's show. And I very much look forward to the next time we can hang out.
Me too. Thank you. Goodbye, everybody.
There you go. We have, you know, look, I say it all the time, but we really do have the highest level of expertise grace our humble show here at Voice Essentials, and Wendy has just kicked us off in such an amazing fashion for the year. Make sure you take an opportunity to rewatch. There were these little gems all throughout. Like it was like Dr. Wendy was just skipping along and just throwing little pearls of wisdom along as she went. I want you to go make sure you pick all of them up, because there are so many little things there that you can be doing, you know, for the health of your voice and, if necessary, for the reconditioning of your voice. And so I hope you'll do that. Next week, we're going to be getting together for a Q&A. A Q&A, if you're not familiar, is simply where you ask the questions and you throw them into the live chat, which is just happening right there. And we list the questions and we answer them to the best of my ability. And it's always a lot of fun. So make sure you subscribe and hit the white bell icon just so you don't miss a live show, because they are a lot of fun. And then in 2 weeks' time, we've got a very long term friend of the show, Michelle DeVoe. I can never say her last name. Anyway, Michelle will be joining us in 2 weeks, and we're going to be talking about all things voice, topic yet to be decided, but it will be interesting. I hope you'll join us then. I hope you have a great week, and I very much do look forward to seeing you next week for the Q&A. I'm Dr. Dan. Sing well.